On our program today, we're talking about colorectal health, diseases of the colon, and treatment options. And I'm so happy to have with us in the studio Dr. Malcolm Henoch. He's a practicing gastroenterologist, and he also happens to be the Chief Medical Officer for Oakwood Healthcare. Welcome to Champions of Care, Dr. Henoch.
Thank you, Mary. Happy to be here.
Let's start talking about colorectal conditions. What is inflammatory bowel disease and what causes it?
Mary, inflammatory bowel disease is a collection of diseases. Two that are most commonly known are something we call ulcerative colitis and something we call Crohn's disease. They're similar in many regards, although ulcerative colitis is a disease confined to the colon, whereas Crohn's disease can affect any part of the digestive tract. What's common about those two diseases is they both are manifestations of the body's own immune response. So the body actually reacts to some stimulus, not one that we really completely understand, but the immune reaction causes damage to the bowel, and many of our treatments, especially those that are medical, are attempt to cause that immune response to be settled down.
Now, say more about the treatment options for these conditions.
In most cases, Mary, our initial treatments are medical. There are a variety of drugs that are available today. Some of them are taken by mouth, and some of them are administered intravenously or by injection. But the purpose of all of these drugs is to, as I said, to quell or cause a subsidence of this immune reaction, which actually results in damage to the bowel. In cases where those medications don't work, surgery is the best option, and in those cases where surgery is required, its purpose is to remove a segment or a section of the digestive tract, whether that's the colon or the small intestine, in order to eradicate that very diseased segment of the bowel.
And Dr. Henoch, what is diverticular disease and how is that treated?
Diverticular disease is quite separate from inflammatory bowel disease and is also not a cancerous disease of the bowel. Diverticulosis, as we call it, is a disease of weakening or weaknesses in the wall of the bowel, in the wall of the colon, in fact. And any part of the colon can be affected, although the left colon and the sigmoid colon are most commonly affected. It's estimated in this country that nearly 2/3 of individuals, by the time they're 60 years old, have developed some diverticulosis. Now, even though diverticulosis is very common, it relatively rarely causes problems, and when it does, it's a result of these diverticuli becoming inflamed or infected. And when they do become infected and inflamed, the best treatment or initial treatment is with medication, antibiotics, but if that doesn't cause a quick subsidence of that infection, surgery again may be necessary, because untreated, this problem can become severe, resulting in abscess or even perforation of the colon, which are relatively very severe and very serious conditions.
Now, we talked earlier about colonoscopies as a tool to detect disease. What are the circumstances under which surgery might be needed to correct something found during a colonoscopy?
So you heard from Dr. Azraq and from Dr. Sloan using the colonoscopy as a means to detect cancers of the colon. And frequently surgery is required. In fact, almost always surgery is a mainstay of treatment for colon cancer. As Dr. Azraq suggested and Dr. Sloan, early diagnosis of a cancer creates the best opportunity to treat and cure that cancer. But the principal therapy in almost all cancers of the colon is a surgical resection of the bowel. And the surgeon, either by an open operation where an incision is made in the abdomen, or through a laparoscopic or what we call minimally invasive procedure, can enter the abdomen, remove a segment of the colon, and rejoin or reunite the section of the bowel above and below that cancerous or diseased part of the colon. So that's where surgery is used for colon cancer. As I mentioned before, surgery can be used to treat diverticular disease, and surgery similarly can be used to treat inflammatory bowel disease. Many of the techniques the surgeons would use are the same in any of those conditions. It is preferable, especially with the advanced technology we have, surgical technology, to use these minimally invasive and even sometimes robotic procedures. The reason for that is incisions are much smaller, it's patient's recovery time and patient's discomfort and patient's healing after the surgery is improved, and their return to health and work or their previous situations is enhanced using these minimally invasive techniques.
Now, what is a colostomy? That's one thing I haven't heard you mention.
A colostomy is a kind of a surgical procedure. So in any of these circumstances, a surgeon at the time of the procedure needs to decide whether when a diseased segment of bowel is removed, whether the surgeon can safely reconnect the bowel above and below that diseased segment. If in the surgeon's judgment at the time of the procedure that can't be safely done, then what we call a colostomy, which some people call a bag, is the best decision. Now, a colostomy may be temporary. In some cases, it may be permanent. What the surgeon does is actually fashion the bowel and bring the bowel to the skin, to the outer wall of the abdomen, and then an appliance is attached to that so that the stool, the waste material, is collected in that bag. So it's obviously not an appealing circumstance for patients, but in some situations, usually relatively few, but in some situations that's the absolute necessity or best way to provide the patient with the best chance of recovery and healing.
Now, you spoke earlier about minimally invasive surgical techniques. Is there anything else on that leading edge of technology making colon health and colon treatments much more advanced now than it used to be?
Well, the field continues to expand in terms of the techniques, the instruments that the surgeons have available. Another way to treat cancerous disease is with radiation treatment. And you've probably even heard about the CyberKnife, which Oakwood has. Mm-hmm. So there are a number of advanced technologies, not surgical or medical, but radiation as well, which can be used to treat, in this case, cancerous diseases of the bowel.
Well, Dr. Henoch, you have taught us an awful lot about the colon and colon health and colon diseases. I want to thank you so much for being with us on Champions of Care today.
Thank you, Mary. It's a pleasure to be here.
And when we return to Champions of Care, we'll talk with a registered dietitian about the top 3 things you can do to prevent colon cancer in the first place. So stay with us.
Packers,
Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.